Unlocking Success in Minority Health Programs. Welcome to the HIVLLC channel. If you're a health or program leader working to improve health outcomes and tackle health disparities, this channel is for you. Our mission is to empower leaders like you by providing interdisciplinary insights and actionable strategies that benefit vulnerable and minority populations. If you're a health program manager working to address health disparities in minority communities, you know that achieving the intended outcomes can be a challenge. You've probably faced moments of frustration, confusion, or doubt when your well-laid plans just don't seem to be working. But don't worry, you're not alone, and more importantly, there are ways to turn these challenges around. Today, we're going to explore why your programs may not be reaching their goals, how to overcome those barriers, and the steps you can take to make sure your program succeeds. So grab a notebook because we're diving deep into how we can make real change in the communities that need it most. Whether it's improving health outcomes, increasing access to services, or reducing health disparities, health programs targeting minority communities can face unique hurdles. But every challenge presents an opportunity for growth. So let's dive into these common problems and identify how we can fix them. First, let's talk about identifying gaps. Too often, we assume we know what the community needs, but we may not be engaging with them enough to truly understand their lived experiences. One of the main reasons programs fail to meet their objectives is because they're based on assumptions rather than real needs. To fix this, start by doing a community needs assessment. Have you spoken to the people your program is supposed to help? Are their concerns being reflected in your program design? Consider using surveys, focus groups, and community meetings to gather feedback directly from the community. You might be surprised at what you find. This is the best way to ensure you're addressing their most pressing needs and not just what you think they need. Don't just rely on old data. Get real-time feedback to ensure you are on the right track. The challenge is building trust within the community. Minority groups, especially historically marginalized populations, may have had negative experiences with healthcare institutions in the past. This can lead to skepticism or resistance to participating in your program. So, how do you overcome this? First, it's crucial to be transparent. Communicate clearly about your goals, how you plan to involve them, and how their input will directly influence the program's outcomes. Build relationships over time by being present in the community and demonstrating that you genuinely care about their well-being. Trust isn't built overnight, but through consistent, empathetic, and culturally sensitive engagement. Think about this as a long-term investment in the community's health, not just a transactional program. Next, let's talk about data. Too often, program managers focus on the wrong metrics. Things like the number of people served or how many activities were conducted. These are important, but they don't tell you if your program is truly making a difference. Instead, track metrics that directly reflect the outcomes you're aiming for. For example, if you're working to reduce hypertension in a community, track the changes in blood pressure and the adherence to medication regimens. If you're aiming for better health education, Track knowledge retention and behavioral change. Don't just collect data, analyze it and adapt your program as needed. Make sure your evaluation tools are measuring what matters most. Sometimes the key to success is not just what you're doing, but how you're doing it with your team. Are your team members fully engaged and aligned with your program goals? Do they have the resources and training they need to effectively reach the community? Empower your team with the skills and knowledge they need to be successful. Offer ongoing training, share best practices, and ensure they understand the cultural context of the communities they serve. A motivated and informed team is a powerful force that will drive your program's success. Lastly, let's talk about sustainability. A successful health program shouldn't just provide temporary relief. It should be designed for long-term impact. If you're not thinking about sustainability, you're setting yourself up for failure. To ensure long-term success, build partnerships with other local organizations, seek ongoing funding, and create self-sustaining mechanisms within the community itself. Teach community members how to take charge of their health and ensure they have access to the resources they need even after the program ends. So there you have it, identifying gaps, building trust, measuring the right metrics, empowering your team, and ensuring sustainability are all critical elements in making sure your minority health programs achieve their intended outcomes. Remember, program success doesn't happen overnight, but with thoughtful planning, engagement, and persistence, you can overcome these challenges and make a meaningful, lasting impact on the health of your community. Don't forget to subscribe for more insights on community health leadership. Drop your questions or share your experiences in the comments below. We'd love to hear from you. Together, we can improve health outcomes and build stronger, healthier communities. Thanks for watching, and I'll see you in the next video. You are making meaningful change.